lower price than traditional plastic surgery. Good evening, my name is Sarah Wong. Tonight we have Dr. Samuel Lam, who is here to share with us his revolutionary approach to facial rejuvenation and hair restoration. Dr. Lam is a graduate from Princeton University and Baylor College of Medicine. His professional training was completed at Columbia University. Dr. Lam is double board certified by the American Board of Facial Plastic Reconstructive Surgery and Head and Neck Surgery. In addition to his many medical awards and accomplishments, Dr. Lam is also a talented photographer and artist. He did his own illustrations for his medical textbooks. In between his speaking engagements and work, Dr. Lam enjoys painting and drawing. He's also a member of EO. Ladies and gentlemen, it's a pleasure to present Dr. Lam.
Right. I think the objective tonight is we're going to move all the WPOers back to the YPO world. Is there enough room? All right, we're going to have a little fun tonight. The goal tonight is not to bore you with a lot of silly details, but I want you guys to start rethinking what you know from the ground up. Tonight's going to be the antithesis, as you heard from the video, of everything you do know or you may know. We have to ask ourselves a fundamental question. What defines youth? And if you think that's sort of funny, I don't think it's funny. And the reason it's not funny is look at a lot of people that have had plastic surgery. They don't look younger. They don't even look like themselves, let alone human perhaps, right? My goal is to restore that. And we first have to understand what youth is. So I always challenge my patients to go out there and consult a few textbooks. You have access to these textbooks. They're known as Glamour, Allure, and Vogue. That is what youth and beauty is, not the plastic surgery textbooks that we may think are the answer. This is what you think about, right? I call the two-finger rule. Don't I look better, Doc? No. You look crazy doing that. So, you know, this is what the traditional model is, wrinkles and gravity. I want to introduce another concept to you tonight, which is loss of volume. And in my opinion, it's the cornerstone to everything that I do for all races, and it is incisionless. So we need to rethink everything from the ground up. What's going to be fun tonight is I want to challenge your perception, and then we're going to challenge everything you know from the ground up. Okay. If there are three components now to the aging process, and I've challenged you and thought volume loss is there, when does it happen? It actually happens from the day you're born. And in a way, it's good. Don't worry, I'm not making babies here. But the idea is that we lose volume from the moment we're born. And I'm going to go through the evolution of shape, a new idea that I came up with and I presented for the first time only about 2 weeks ago in St. Louis. Wrinkles and gravity occur later. And that's an important thing to understand. Evolution of shape. Let's focus on shape. If we start with a child, the child is round. And that's how fundamentally, if you look at another person, you can make an instant judgment about that person's age before you can see a wrinkle, before you can see any gravity effects. You say, oh, that person is a certain age. And why is it? It's to do with shape. And if you look at the shape of a child, it's a circle. As we proceed into our teenage years, it's still a circle. And that circle, some people don't particularly care for when they're young. They say, boy, I'm too round. And that's a lot of baby fat. What happens in their early 20s? Same thing, it's still a circle. I know this talk is getting boring now. We're going to change shapes in a moment. And as we proceed forward into our mid-20s, there's a hint of a triangle coming through. And if you look at the face, you can begin to see it. So forget for a moment that your brows need to be in the ceiling, and forget about your neck needing to be way up here, and start rethinking what you see. That's what I do every day. As we go into our late 20s, what you see is the triangle with a hint of the circle. Can you guys see here? I'll move over here. And you can see that that's beginning to show through. As we proceed with age, into our early to mid-30s, we have more of a triangle, and you can see it there. What's really interesting is about 80% of my work is on females, so my focus tonight is on women. I do men as well. But if you take a look at this, this is oftentimes 80% where women want to be. They don't want that early 20s look when that face is so round. So the question is, how do we get there? Is it just an a priori decision on my part to do something for you? The answer is no. What I do is I start with your old photographs so that I can have a blueprint of design where I understand where you want to be. as we go forward into our late 30s, early 40s, we get a little bit of hollowness around the eyes. And so what you may perceive as ptosis or hanging, it's deflation. And the lower face maybe gains a couple pounds after some children. And there's a flattening, there's a squaring off of the face. And as we continue with age, we gain some weight into our mid-40s and 50s, and the lower face begins to dominate. So you begin to see this inverted triangle peeking through. And obviously this would be an extreme example. Hopefully none of us get to this point. But there's a lot of hollowness around the eyes. That's extreme aging. And the lower face truly dominates. So what is our objective in all this? The objective is to flip the triangle. Not necessarily create a circle, but to create something that I think most people would think is beautiful. And that's what we're trying to achieve. What's interesting is there was an article recently in the New York Times that looked at what our current culture's perception of beauty falls. And where it is right now is actually more of a circle. That may be, I don't know, if a male-dominated perspective or not, and this is an early 20s look, but that's fullness. And that's not necessarily what most people want. But it's an idea from our perception of society, what we see as beauty. And that's sort of an interesting aside. Okay, let's start with someone that's gorgeous in her 50s and why. Let's break it down fundamentally, analytically, why. Let's start with a brow. Now, when I say brow, what does that mean? It's not just the sculpted eyebrow. It's the entire soft tissue complex that resides over the eyelid. Now, look at that for a moment. Is it very high, sculpted, or is it low and full? It's low and full, right? Okay, but does it look low and full to you? It doesn't look bad. It actually looks gorgeous. So we have to challenge our idea, because when you come to my office and say, don't I need this, doctor? You can go to my colleague, okay, but not me. Take a look at that eye. Now, some people actually like her in her 50s more than her 30s, because there's that triangle. Do you see the triangle? Look for the triangles. Don't look at the wrinkles. Take yourself away and start looking at what's beautiful. Now, I'm glad you haven't eaten yet, because the next photo is scary. If you like the photo on your right, you can get up and leave right now. Clearly, if you take a look at that brow, it's much higher than it was in youth. It's empty, it's sculpted. Is that young to you? No, clearly not. Because if you think about the aging process, it's volume depletion. We just established that. And this woman had her age advanced through traditional surgery and her identity taken. So she actually, I think, had a little fat grafting because she looks better than this photo recently. But in the same token, I think she did go through the process of looking, well, you can pick the word. So let's have a little fun idea with this. When we're young, we're grapes. As we get older, we become raisins. So the question I have for you is, why should we take that raisin, cut, pull, stretch, and lift it into a pea? Because a pea looks nothing like a grape. And I can probably tell you, you probably see a lot of peas walking around town. Why don't we take the fruit, not make you look like a fruit, but bring you back to where you were? And that's so important, right? I don't think anyone wants to look like a different human being unless you're in the witness protection program. That's something that I don't encourage and I don't take care of. The other thing is rethinking how we see the world. Men probably don't get this, but women may. And the idea is oftentimes the way that men perceive the world is fundamentally different from women. I think all that's an obvious idea, right? Women tend to micromanage the face. They get very close to a mirror, and that's normal, because as you put makeup on, you don't want your lipstick going over here, and and I assume the men are not putting lipstick on. It's maybe is that true? Okay. But if you take a look, it's too close to the mirror. So every little tiny wrinkle, it's this little dot. It's that little thing that makes me look bad. But when I do an analysis of the face, I stand about 5 feet away. Because why? That's how you and I see each other, right? We don't get up close and are 2 inches away from our face going, this little line makes me look bad. Of course I can manage all that, but it's rethinking what you see and what you know. And that's so important here. I think this is exciting. Most people today, I would assume in this room, don't want an incision. This is entirely incisionless. That's a nice thing. No bandages, no sutures, no knives, no cutting. So this is a different idea altogether. Let's talk about the eye. If you start with the area that I consider the most important thing, it's the eye. Because if I'm done with you and you still look tired, I've done nothing for you, right? If someone comes up and goes, oh, do you have enough rest? What's going on? Are you hangry? Then I've really done nothing for you. Okay, so let's